Now back to one of our top stories this evening. The new National Health Insurance Bill has been introduced in Parliament. Health Minister Zweli Mkhize says this brings the country even closer to its goal of providing quality health care for all South Africans. But its implementation is still years away, and we now get some reaction on it from Democratic Nursing Organization of South Africa's Acting General Secretary, that's Gwena Manamela, who's in our Pretoria studios. Gwena, thank you so much for your time this evening, and I suppose I want to start with Denosa's stance on the NHI. Where do you stand?
Good evening to you and the viewers at home. As Denosa, we welcome the long-awaited release of the National Health Insurance Bill because we think it is long overdue, and its release comes with a very great relief, although we believe that it has taken some time to arrive where we have arrived now. But we support the National Health Insurance because of its emphasis, and we believe that its emphasis talks to what the nurses are doing on a daily basis. Especially is talking about the issue of re-engineering of the primary health care, of which it talks about the most basic of the health care, as it also promotes a healthy nation, a healthy society, of which we believe that if the society is healthy, they will contribute to a lot to the nation and to the economy of the country as a whole.
Said, is the nursing organization prepared for the NHI, especially with the shortage of nurses in some healthcare facilities been reported?
Yeah, the infrastructure, as we speak, might not be accepting to the implementation or the full implementation of the National Health Insurance as it may, especially based on what you have said already, the shortages that are there in most of the clinics, in most of the hospitals that is experienced. Because in terms of the standards, we believe that we are not where we're supposed to be as a country, because practically on the ground, if you look on the ground, we would so much want to provide the healthcare as NHI will come with. It speaks to access to healthcare, and we believe that we'll accept more clients or more patients or more healthcare users, and that will come with a lot of expectation from the healthcare providers, the nurses, so to speak. And based on the numbers of the nurses that we have in the country and the shortages that are there, that expectation might be a moving target that we will find ourselves not actually reaching if the government might not prioritize the quantity and the quality of the human resources, especially the nurses, so to speak.
Mr. Manamela, let's just also take through some of these, sort of systematic challenges that we're seeing in the healthcare, system right now. I mean, we know of, unemployed nurses who still can't find employment even after completing their community services. We know of critical medication in some clinics, such as Limpopo, that still cannot be accessed. We also know that the healthcare, facilities are currently in jeopardy right now with some crimes and criminal activities taking place there. How do you think the NHI will solve some of these systematic challenges faced by the healthcare, industry?
Yeah, exactly the challenge that we have, because we don't understand that government should go a long way to train the nurses that at the end of the day they can't be absorbed. You rightfully cited the example of Limpopo province, because practically, if you look at how the services are provided, especially we talk about the 24-hour services that need to be provided, because when we talk NHI, we don't want to talk only a service that will be from 8 o'clock to 12 o'clock, but we want a service that will be there for 24 hours accessible. So the situation where we are, we can't understand, because clinics, most of them in the country, are not operating as I speak a 24-hour service because of the practicality that is there, the shortages that are there. So it is practical that there is a shortage, but we don't understand why government can absorb the nurses to try and beef up what is practically there in the situation. And as we speak, NHI will improve access because many people will now have access to healthcare. So there is no synergy really between why the nurses that are trained are sitting at home. They can't beef up the system whilst we are expecting more access to our facilities. But we believe maybe once the NHI is fully implemented and resources have been properly allocated, maybe we'll have that problem resolved. That is our belief.
All right, Denosa Manamela, thank you so much for your time, sir, this evening.